I think we're going to talk mainly about sleeve gastrectomy today because that's the most popular procedure. But I'll try and address these questions in a bit of a progressive way. First of all, what's it like just after the operation? How are you going to feel? Well, a lot of patients feel pretty tired after surgery. Most of my patients are in hospital for 2 or 3 days. They're coming home. They're pretty mobile. Occasionally have a bit of nausea, usually not. They're just drinking fluids. But they feel pretty tired. They feel pretty washed out. I encourage everybody to have 2 weeks off work. If you have a really physical job, you're probably going to need 3 weeks off work. We're not really sure of this mechanism, but it seems as though in the early phases after surgery, your body's burning up a lot of fat. And some of those fat metabolites going around the body can make you feel quite hyper. So much so that you might go to bed at a normal time, but then not be able to get to sleep till about 1 or 2 in the morning, and suddenly you wake up at 5 in the morning, feel pretty awake really, and then you go through the day and sometimes need to have a bit of a nap at about 2 in the afternoon. That's really common. That can go on for 2 weeks. It can be a bit disruptive. That's another reason why you wouldn't want to go back to work in the first 2 weeks. Is you're going to lose weight really fast. I've seen patients lose 5 and even 10 kilos in the first week. It's not going to be like that for too long, but in the first week or 2 it can be pretty quick. And when you're losing that amount of weight and you're burning up fat fast, you're going to need to drink a lot. For some patients this can be a bit tedious. It's really variable. Some people can drink just easily and others have to sip for about 2 weeks, which can be pretty frustrating for them. A lot of patients find water doesn't go down well at all, probably because it's got a lot of high surface tension, and if you can just break things up with apple juice and cordial, the fluids tend to go down better. Another thing that patients always tell me is that their tastes change really quickly. Even the smells of food can change. And things you might have liked in the past just not going to sit so well. A lot of patients have problems with free sugars. If you have ice cream or if you have coffee chill or really sugary drinks, they just go through you really quickly. And a lot of patients have what's called dumping syndrome, when they have very loose stools, when they have sugary foods, and they can actually have abdominal pain and discomfort when they have sugars. And quite quickly, a lot of patients realize that the easiest thing to do is just get rid of the sugars from their diet. Another thing that can sometimes happen is fatty foods. Just the smell of fats doesn't sit very well. You might have liked fish and chips before, you might have liked things like roast meats. Well, that's just going to change. And we find that patients' appetite is massively reduced after sleeve gastrectomy, but also their choices are different. And most patients tend to make healthier choices without even being asked to. And that's very interesting, and we don't fully understand that, but you'll definitely notice that. You might be into exercise or not into exercise, but after this kind of surgery, you're really going to need to start thinking about exercise and actually doing it. We know a lot of patients will lose some muscle when they're losing weight fast. It's really important to try and preserve your muscle. Really, anything you do is good. We recommend swimming because it's all over exercise really. Weight training is good, yoga is good, Pilates is good. It's really a mixture of aerobic and resistance training. We can talk about that in another video. Another thing that may happen after your procedure is that you get off a lot of your medications. We see people on blood pressure meds, meds for cholesterol, treatments for sleep apnea with CPAP machines, and a lot of diabetic meds. And it's very important that we see you a fair bit in the weeks after surgery, as blood pressure can go down and a lot of patients can actually stop and hopefully not commence their blood pressure meds again. We also know that a lot of diabetic patients are in remission, i.e. they're off their diabetic meds pretty quickly. It's also not uncommon when you have sleep apnea to have a procedure. Often losing the first 10 kilos makes your sleep apnea a lot better, and many patients are able to give away their CPAP machine within a few months of surgery, which is great. Just about everybody mentions to me is that they get a lot of attention from other people after this operation. You really need to be prepared for that. We actually have a clinical psychologist here who can assist you with these sort of things if you feel you have the need for that. But I'm just letting you know that you'll have people, friends, family, people who don't know you very well, just coming up to you and saying, "Are you okay? You know, what's been going on? How come you lost so much weight?" It can be a difficult time, and you need to have an answer for it. Obviously, feel free to say what you want, but we generally tell patients, don't tell everyone if in these early days. Choose who you tell, whether you've had an operation or You can always just say you're eating less and exercising more and that's why you're losing weight. It's not really a lie, but it's certainly something you can say. But it can be quite a difficult time because a lot of your colleagues might be quite judgmental about your decision to have surgery. And the best thing is just try and avoid the subject or just say you're exercising more and eating less. I think that's the best way to go. And we all love going to restaurants, but if you've had a sleeve gastrectomy or a gastric bypass, it can be a bit of a challenging experience. For a start, you're never going to have a whole main. You might be splitting a main with your partner or having an entree. Your taste might be a bit different. And another thing that people are always telling me is that they get a lot of grief from waiters from time to time. Why haven't you finished your meal? Is everything okay? Just be prepared for issues in restaurants. Another thing is drinking. It's okay to have a glass of wine from time to time, but one of the issues in restaurants is if you have a glass of wine or drink some water and then try and eat straight away afterwards, it can be really difficult, and it takes probably about 3 or 4 months to fully get to grips with eating out. It's not that common. It seems to be on every blog anyone ever comes in, the first thing they say is, oh, I'm going to lose my hair if I have this sleeve gastrectomy. It's just not the case. 95% of people don't have any issues at all with hair loss. 5% of women will have some transient hair loss after a sleeve. It's always transient, it's never permanent. But if you're losing hair early on, you could lose hair for the entire year. It just goes on and on until you plateau at your new weight, which is about a year. Don't spend a fortune on multivitamins. Don't spend a fortune on zinc and selenium tablets or hair and nails tablets. It's just not going to work. It'll get better on its own. Well, be reassured, most people don't need skin fold surgery. Only 10% of people do. It's pretty predictable. If you're over 50, you don't have a lot of elasticity in your skin anymore. And if your BMI is very high, over about 50, it's pretty likely you might need skin fold surgery. But the vast majority of people don't need it. So you should be largely reassured. You will have a bit of excess skin, possibly a few stretch marks, but it's probably not as bad as you'd imagine. This early period after surgery is just keep out of clothes shops. A lot of people, as they lose weight, they want to rush off and buy a new pair of jeans, a couple of sizes down. It's all very exciting. All I'm going to say is you're going to lose weight so fast, or most people are anyway, that you could spend a fortune on clothes in the first year. Just shop cheap. I mean, I tell patients to try and shop in Kmart. If you buy a pair of jeans or a shirt or a dress, you could only be wearing it for 2 weeks, and it could be a very expensive year.